Good morning, good afternoon, good evening, wherever you are. Welcome to this MDS roundtable, which is run by Blood Cancers Today. It's a true pleasure to be with you today. My name is Amer Zeidan. I'm an associate professor of medicine at Yale University. And today we will be covering a lot of the exciting developments in the field of MDS. The last couple of years have seen important approvals and some important changes to the risk stratification as well as the classification of MDS. And to debate all of these new aspects, I'm joined today by three of my colleagues. All of them are top experts in MDS. So Jamie, for you, when you talk to patients about lower risk MDS, how do you define it? Like, what is for you lower risk MDS in terms of management?
Sure. So I spend a lot of time, talking with patients about low risk MDS. I start out by just explaining sort of mechanistically what's going on. The analogy I like to use is the bone marrow as a factory. And then, just as you had referenced, I explain that MDS really presents across a wide spectrum of severities. And, I start to talk about how, patients on the lower risk end of the spectrum of severities tend to have, more intact blood counts, fewer blasts in their bone marrow, generally normal cytogenetics or minimal cytogenetic changes. And then I explain how at the other end of the spectrum, we're really approaching an acute leukemia, and how these individuals will often have complex cytogenetic and molecular aberrations. They may have an increased percentage of bone marrow blasts, and they're often, have cytopenias affecting multiple cell lines. So, that's how I kind of explain the spectrum of MDS. And of course, for patients who are on the lower end of this disease spectrum, our goals are very different. These are not the patients who necessarily need to be transplanted right away unless maybe they have truly transfusion requirements that can't be overcome with treatment. These are people who are going to be living with their disease for a period of, many years. And so our goals of therapy are really to improve their quality of life and minimize their symptoms. And then I kind of start to talk about ways in which we're able to do that.